Thank you for inviting me to speak today about my experience of brain injury. So 30 years ago, I was driving to my old school to play rugby for the old boys, and I was rather keen to get there. I don't remember anything about it, of course. That day I've got 24 hours of retrograde amnesia. I didn't arrive. I hit a tree in my mother's car and wrote the car off and spent the next three or 4 weeks in intensive care, 3 weeks on the ventilator, and with about 6 or 8 weeks of post-traumatic amnesia. So luckily I don't remember anything of my early disinhibition in ITU, which was apparently quite severe. Some of my earliest memories was I was lying in bed in a strange hospital, and the physios were bullying me, and I was surprisingly relaxed. I wasn't particularly shocked or surprised, which is probably a feature of the pathology itself. I think I don't particularly feel anxious or ashamed or embarrassed by anything. I'm quite anxious today, actually, so perhaps that's not necessarily true. But quite shocking when you suddenly, it should be quite shocking, this lying in hospital bed, wondering what the hell's going on. I couldn't move my left side at all. My left side was totally paralysed. And one of the nurses was giving me some medication, and I said, what medication are you giving me? I was a newly qualified doctor. I knew all my medicines, and I thought I should be helped to understand what I was being taking. And she patted me on the head and said, "It's to make you better." I thought to myself, doesn't she know I'm a doctor? What's going on here? This is slightly unreal. So anyway, the physios continued to bully me, and I learned to put one foot in front of the other and learned to balance and stand up, and it was pretty difficult. It was hard work, and I spent a lot of the time asleep. I was in hospital for 3 months. Then I was referred to the Wolfson Rehab Centre in Wimbledon, where I spent another 4 months learning how to walk and how to behave and how to start thinking about resuming my career as a doctor, which I was very keen to do. I'd just qualified. Was about 3 or 4 months into what used to be called house jobs, and I called foundation year training jobs as a newly qualified doctor, and hugely enjoying it. And I was in a relationship which petered out over the next 2 or 3 years due to my personality change, which I didn't initially appreciate at first. I felt exactly the same person as I had been, but over the ensuing months and years, I think, I gradually learned to accept more and more of the changes that had been thrust upon me. I was quite a keen sportsman. Like the odd drink. It's funny, I'm still in touch with all my old rugby playing colleagues, and they quite enjoy taking me out for a beer or two, because it's quite cheap entertainment for them, because I sort of start about 4 or 5 pints up, effectively, from my behaviour. So it takes 1 or 2 pints to tip me over into being quite. I need to be very careful about who I choose to be with at those sort of times. Potentially I can upset people. If at any point you can't understand me, please just shout, saying "what?" Because I'm quite used to being told to repeat myself, because I have slight dysarthria, which my 2 sons reminded me. I came in from a busy day's work, and I'd done some work in the evening as well. I was about 8 o'clock, and I spoke to them, and they looked at each other and just said, "No, it's just noise. You don't understand the thing that he's talking about." So I sometimes have to try and speak more clearly to make myself understood. My secretary likes it when I do my types in a South African accent, because then each word is enunciated clearly, and she has a much better understanding of the types. So it's been a long, hard struggle, and I've enjoyed a huge support. And my training hospital, the Middlesex Hospital, which has been torn down in the West End of London. I don't know whether any of you know it, but it's been torn down, and last time I saw it, it was replaced by wooden scaffolding. It seems like myself, because I was there for about 12 years in all. I did a lot of my post-registration training jobs there in psychiatry. Left there to become a GP, became a GP partner. then again, that's quite stretched my role, actually. I think it was quite a difficult time in the mid-90s. We were doing all our own on call, and I found it quite demanding to be busy all day and then busy all night, and busy the subsequent day as well. It quite stretched my ability to cope. So then I went back to, I did a locum in my leave time, and I realised that psychiatry was where my heart was, because you have longer with the patients, more time to consider. It's much more sedentary, usually, unless you're chasing manic patients down country lanes, which I've been known to do, not very effectively. Right, so let's go on a little bit more about how the injuries affected me. Frontal lobe syndrome, as many of you may know, is a tendency to fatuous euphoria, disinhibition, over-talkativeness. Sorry about that. Please arrest me if I'm talking too much. The lack of concern for the feelings of others, which isn't it's not on my CV, I don't advertise that much. The left hemiplegia is it's the way I didn't realise about hemiplegia actually, or spasticity, is it gets worse. The more you exercise, it gets acutely worse, you get stiffer. If I start walking, I'm fine for 100 yards, 200 yards, but then I get stiffer and stiffer, and I start to wobble more. And most weeks I fall over about 2 or 3 times, and I could fall for England. I'm well practiced. I've learnt to let myself down gently. So when I do take a tumble in the street, it's not something I'm quite used to, but it's quite shocking for passers-by. Left-sided neglect and inattention. Obviously, it's not something you're immediately aware of, being not a left-sided neglect and inattention. Not something that you're aware of, because it's by definition it's a lack of attention. But it gets pointed out to you. The first time I was aware of it most acutely was when my brother took me in for a driving session about a year after the injury, and I went over to Dublin to see him. Got in his car and he drove down. I was driving the right side of the road, and they have left-handed driving in Ireland as well. So he said, "John, don't ever drive again. Have a test from the DVLA, etc., etc." So I formed the DVLA, and I sent a nice elderly retired neurologist doctor who put a few lines on a bit of paper and said, "Cross all the lines you can see." So I did that fairly easily, and he said, "You don't have any left-side neglect or inattention?" And I said, "Oh, great, that's fine." So, but I do. I think that's a very crude test. I think it needs to be. Visual spatial awareness and memories is not great, because I get lost in department stores or car parks, whatever. I lose my bearings, and also I don't recognise a lot of my patients unless I've seen them 2 or 3 times. I don't necessarily recognise them. So if I'm walking around the hospital sometime and someone says, hello, doctor, I say hello as if they're my best friend. Just can you remind me of your name? Once they tell me their name, then I remember who they are. But their face, I wouldn't necessarily recognise them, because the visual cues are not there. Sleepiness and fatigue. I was going to say about sleepiness and fatigue. Tiredness is a general lay term which we use. I tend to use sleepiness or fatigue, because there are 2 different things. Fatigue is treated by rest, and sleepiness is strangely treated by sleep. And they're 2 different things. I'm not quite as cognitively agile as I used to be. I can't multitask. If someone tells me to do one or 2 things, fine, but if they tell me to do 5 or 6 things, I'll lose one of them, because I can't do too many things at the same time. So if I'm walking around the team base and my colleagues say, "Can you prescribe such and such?" I'll say, "Yeah, put it in an email for me," because they'll understand, and they make that very, very easy for me. Let's keep going. Yes, this medication, modafinil, some of you may be aware of it. I find it very useful, because I used to fall asleep in meetings, lectures. Unless I was actively involved in what was being discussed, I just used to fall asleep. And one of my consultants shouted at me, "Wake up!" which is very effective for about 5 minutes, but after the adrenaline wears off, it just go back to sleep. But it doesn't improve energy levels or fatigue. And I know students do use it as a sort of cognitive enhancer for exams and things, but I'm not quite so sure it helps. Make them awake an hour or 2 longer if in the evenings or whatever, but I wouldn't use it as a cognitive enhancer. So I'm leading a very successful life, which is strange, because most of the head injury patients or head injury victims I come across haven't been quite successful. And it's often down to a lack of support and availability of resources to help them, which is a shame, because I've had tremendous support, and not least by family and friends, and my poor wife, who I knew before the injury. And we recently learned about the coach test. So how are we doing for time? we know about the coach test, which some of you may not know about. The coach test I learned about on a neuropsychiatry teaching weekend, and they showed us two or three vignettes of frontal lobe patients, and they were affable and talkative and garrulous, and they would all fail the coach test. You wouldn't want to share a long coach journey with them. I told my wife about this coach test. She said, I've been on a very long coach journey and I want to get off. But she was joking, of course. Those are my two sons who I'm immensely proud. That's Louis on the extreme on your right. He recently played rugby at Twickenham for the Oxford under-21. I had a few divided loyalties there, being a Cambridge man myself, but blood is thicker than water. So, and he was only 6'4". My wife was the tall one. She has a very long reach. So, what have I found most useful? I was recently referred to Maudsley to our colleague Mike Dilly, who will be presenting later, I think. And he asked me during the thing, he said, what do you think would be most useful? I think that an hour's rest at lunchtime would be. I can understand why the Mediterranean types use a siesta, because it's very, very good for recharging batteries, because I do work hard in the mornings and have an hour's lunch. But actually, these days I now get sleepy at lunchtime, which I didn't do before. But now I sort of miss my sleep if I don't have it. So I have about 40 minutes of sleep at lunchtime. And I use Dragon dictation software for dictating into the notes, because I can't type so well with my hemiplegic left arm. And so that's it's a bit of a curse, because my computer wasn't powerful enough to use this wonderful new software, and I've now had a replacement computer, and but the software has not been used on it, so it's not quite as smooth as it should be. I've got a wonderful set of admin staff, and they're very, very supportive and understanding, and I'm just very appreciative of the help that they provide for me. My colleagues are all aware of my difficulties and trying not to overload me, although it's not easy at times in the mental health trust of dwindling resources. And I use lists. So memory problems, I think, memory problems are, when people ask you, do you have a problem with your memory? It's not quite that simple, because in many things I've got a very good memory, which my consultant colleagues all realise, because for example, recently there was talking about a patient, and they had a very strange spelling of their name, and I spelt the name perfectly, and they said, John's very good at that sort of thing, but give me 5 or 6 things to do at once, and I'll lose them. Tiredness, I've explained, is there are 2 types of tiredness. The Maudsley emergency room, I was called for, this is about stigma, and people often think I'm drunk, which isn't always true. I was called to the Maudsley emergency room for a 136 assessment, a patient to be sectioned in the Maudsley 136 suite. So I arrived at the Maudsley Hospital about 10, 15 years ago now, and I arrived at reception and said, I've been called to the emergency room to help with an assessment. Hold on, sir. He picks up the phone. Yeah, I've got a Mr. Murphy's come for an assessment. No, hold on. You misunderstand me. I've actually come to help conduct the assessment. He's quite anxious. And not for the first time, I was mistaken for a service user, and trying to get off locked wards is more than my life's. It's quite a struggle sometimes. No, I'm the actual visiting doctor, and I wear my badge very prominently, and eventually, I've not been held locked on a locked ward for too much longer than necessary. That's right. When people say, John, are you sure you can do this? And I often say, yes, that's fine, even though I don't know how to do it, because I'm quite embarrassed about being thick and being cognitively impaired. It's not something you want to shout to people about. Neither. Yeah, support from family, friends, colleagues, and others, and everyone I come across is the reason why I've managed to achieve my level of success. But also a pig ignorant lack of insight on my part. I just won't accept the fact that I'm impaired and damaged and second-hand goods. I've still got a few neurological signs and symptoms, and I'm happy to demonstrate those if you need to. I've got a few perspectives to comment on from my perspective. There are more and more brain injured individuals surviving, but there's less and less facilities to help them. But I'm aware that when people have a claim on their behalf, they get appointed a care manager, and that could be one way to negotiate their way through to the need for extra resources. And I feel sure that mental health is overrepresented in prisons, and I think acquired brain injury, and something I've managed to escape so far in the prison. But who knows, it may beckon for me yet. Have I been much longer than I should have been? That's it. Thanks very much for any questions.